Hey everyone, DocClaudine here, popping in really randomly because I just wanted to talk a little bit about a committee I've just been asked to be on. I've been asked to be on the Hospital Reputation Committee, which is meeting tomorrow for the first time, and I didn't really know about it until recently and thought it was a super exciting thing to do. So as part of the preparation for it, I went online to our hospital's reviews sections from Google reviews and stuff and kind of browsed through things that patients were saying about our hospital. And I want to preface this whole thing by saying that this is the fourth hospital I've worked in since I've been done with my training, and honestly, it's my favorite. It's a great hospital. We have great doctors, great nurses, really, really dedicated hospital. As far as other places I've been, it's clean, we're collegiate, people get along. All these things, they matter so much when you're in a hospital setting. The doctors are great, the nurses are great. It's a fantastic little hospital. And so I was reading these reviews in preparation for this committee tomorrow. And it was interesting because there's so much that feels like it's not even anything that the doctors or the nurses or the other staff can even do anything about. It's the machine of medicine that I think people don't understand. And it was eye-opening, very, very interesting thing to see. Things like, people are always complaining about wait times in the emergency room. And that's ubiquitous. That's everywhere. I mean, I can't think of one institution where there's not longer than what we would like wait times in the emergency room. And that's because we get to the real emergencies first. If you're coming in with a stroke or a heart attack, a head bleed, things that have to be dealt with immediately, they're coming in first. And if you're sitting in the wait room, if you're well enough to have driven yourself in and sit in the wait room, I'm not saying that you don't need urgent care, but I am saying that you're going to be bumped for the person that's coming in by an ambulance in the back that you may not even see. So I see all these negative reviews about wait time in the ER and, there was only 5 people in the waiting room. What is taking so long? And what people aren't seeing is the ambulances coming through the back and the amount of resources from the doctors, the nurses, the pharmacists, the techs, everyone that's working on those cases that are coming by ambulance to the ER. Hey, Christine, thanks for joining. I was just talking about how I've been appointed to a committee in the hospital, basically talking about reputation of hospitals, and how I just read some Google reviews of the hospital I work at, which I think is a fantastic hospital. So it's just addressing some of the things that people say, long ER wait times, and talking about how it just seems to be a lack of understanding of how these things work in general. If you're the one waiting there, it's because and it's not that you're not sick, but you're gonna come behind the stroke, you're gonna come behind the heart attack, you're gonna come behind these things that are coming through the back door through the ambulances. So that was one thing I thought was interesting. And then I got to thinking, what are we doing as healthcare professionals to educate people about what these basics that we know? We all know an emergency room is crazy all the time, and that, we are doing our best to triage the sickest people, and that we're moving as fast as we can, and we're doing the best that we can. And yet somehow we aren't relaying that to the public. So I kind of wanted to get on here a little bit to kind of ask, what would be helpful for people to know about, things that are very basic to us. Of course you're going to wait a long time when I'm dealing with the stroke that just came in the ambulance. I had to intubate somebody back there. Hi, thanks for joining. We've got somebody who was just in a massive car accident. We've got to deal with that issue. And the person that's coming in to the front side, with a sore throat, they're going to wait. And what are we not doing to convey this to people, that they experience such frustration and not really realizing that behind those doors, everybody's working very, very hard. The other thing I noticed a lot of complaints about was they tend to kind of, leave ER maybe frustrated that they didn't get the testing that they were hoping to get. And again, as a physician working in the hospital, the hospital's for things that have to be done right away. things that don't have to be done right away shouldn't and aren't going to be done in the emergency room. For example, if you have a thyroid mass, yeah, that's uncomfortable and it might be scary to you. But the important part is they've said, we know you have this. But referring you to the proper doctors in the clinic to deal with is the proper way of dealing with that. People get frustrated at being sent out. Well, why aren't you doing my ultrasound now? Why aren't you doing my biopsy now? First off, that the doctors in the emergency room are trained for emergencies. They're not trained for things like thyroid ultrasounds, and these shouldn't be done there, because imagine if we did all of that. That would even increase the wait time. And so there seems to be this very lack of understanding of emergency is for emergency only. And even with that parameter, we have really long wait times. So let's see, Bobby's saying, the best thing about an emergency room is that when there is a life or death emergency, that we have a personal how truly cares about people. Yes, and that is the point, is that ER is life or death. And while we were going to see anyone who comes through those doors, we really, really need to remember, all of us, that an emergency room is first and foremost for the life or death. And when we're dealing with the life or death situations, we will see the sore throats and the fevers and everything else as we can. But those life or death situations are the ones that are coming first. And that is what an ER is equipped for. We cannot handle everything there. We cannot make full diagnoses there. That is not what it's for. I also see a lot of people saying, they could never figure out what was wrong. Again, the ER is for, is it life? Is it death? Can I do something right away? If it's, you're coming in because you think you have cancer, the ER is not the place for you. You have to go to a cancer specialist, your primary care doctor, things like that. So I don't know. Do you guys have any thoughts about, how do we better educate people to understand what an emergency room is used for? Because I feel like so much of the negative reviews that I read about was based on things that just are unrealistic expectations of an emergency room setting. You're gonna have a long wait time if you aren't the guy coming in with the stroke. You're gonna not get a full diagnosis if you have a new thyroid nodule. That's not gonna happen in an ER. So anyone, if you guys feel free to jump in, let me know if you've got thoughts on what else should we be doing as a medical community to better educate people on what to expect. There really shouldn't be a scenario where somebody comes in for a sore throat, has to wait 4 hours because the back is dealing with a heart attack and a stroke, and for somebody to leave a negative review for the hospital based on that. It's just the expectation that person had coming to that setting is unrealistic. And so I'm not sure what we do to combat that. Hospital, the other thing I saw lots of complaints about is the billing policy. Well, good. I'm so glad. I see Christine saying demystifying misconceptions with this live session. Perfect. That's kind of what I'm hoping to do. And if there's any specific questions or examples, then please ask me, because I want to demystify things. The other thing I see a lot of is people complaining about the billing system of hospitals. There's this idea that doctors order all these tests just to rack up the bill. I will tell you that as a physician, as a hospitalist, I have no idea what your bill will be. It's based on so many factors. It's not even something I can even consider, because it varies from person to person, depending on your insurance coverage, depending on whatever billing ends up working out with you at the end of the day. My job is to take care of you. My job is to get you the tests that are appropriate. My job is to just do what is evidence-based medicine based on what your issue coming in is, and I'm going to recommend my testing based on what I know to be best practices. I have no idea what your bill is going to be, and that is incredibly frustrating to patients. I understand that, but I don't practice medicine knowing these things. Okay, and Bobby's saying, when I had a chest pain, I was at Rush Memorial in Chicago, went back to Porter Hospital, and was taken right in because my chest pain. I went to thank you Yes, absolutely. So Bobby makes a good point where he was saying, if you're coming in with an acute emergency, you will be taken straight back. And that is why ER wait times are so long for people who aren't coming in with such things. And then to get back to what I was talking about with the frustrations over billing, honestly, I saw reviews where patients were under the impression that their care got better after we found out what kind of insurance they had. And like I said, from my perspective as a physician, I don't even know what your insurance situation is. Honestly, the only time I'm made aware of it is when I'm sending you home, and it's because I need to figure out if you need services like home health or skilled nursing or medications, and that's the only time I'm made aware because I have to figure out how to work with your insurance to make these things happen. So I just kind of wanted to demystify the billing portion that, we're doing it to make money, or we're doing it to, or that we're somehow responsible for these enormous bills, or, that one hospital charges a crazy bill when you think another one won't. That's not at all the case. Hospitals are pretty standard on what they charge for various things. And then beyond that, it goes to insurance companies and private bill. And the doctors, I guarantee you, the doctors are not thinking about that. They're truly not. Hi, thanks for joining. We're kind of trying to demystify, the hospital setting and ER settings. And this sparked because I was asked to join a committee for hospital reputation where I work. And as part of getting ready for this meeting, I was reading Google reviews about my institution and found some patterns that seem like patients just don't understand the general expectation of coming into the hospital. And so I was popping on here to kind of talk about some of those issues I was seeing, like billing issues and ER wait times, and talking about how, these misconceptions I keep seeing are interesting because it's not at all what's actually going on behind the scenes. So I was right in the middle of talking about patients being very frustrated about billing and how, again, as a hospital doctor, it's not even on my mind. I'm just there to provide the care. And that even insurance status isn't something that I even consider until discharge when I'm trying to figure out what I'm able to get for you as services that I think you need. My recommendation is going to be my recommendation. The only time that insurance or not insurance comes in is when maybe, for example, I think you need home health and you can't pay for that. That doesn't mean I won't still recommend home health. It just means if you want it, you'll have to pay for it yourself. So I hope that's making sense. Anyway, guys, please leave comments about, what else we should be doing as providers to kind of dispel some of these myths that seem to be perpetuated around, patients where, the expectation just doesn't seem to match the reality of things that are going on, or the idea of what people think is happening isn't the truth at all. I know this happens everywhere. I know this happens in lots of different fields. Science and journal articles and vaccines. I mean, there's a lot of misinformation out there, I think, just perpetuated on rumors. And I'm not quite sure, what we do as healthcare professionals to dispel these myths, other than, as someone pointed out earlier, coming on to these live sessions and dispelling some myths. So anyway, appreciate you guys joining me. Thank you. And I'll pop on maybe after the committee meeting and give an update on what we talked about. Okay, thanks. Bye.